Hi everyone, my name is Sara. I'm a physiotherapist at the Fraser Valley Child Development Center, and today we're going to talk about rolling. Some things I want you to consider are, is it a good time for your little one? Are they happy? Are they hungry? All those types of things will affect how much they want to move. What type of clothing they're wearing? Is it loose, comfortable, or is it tight and maybe restrictive? And then also take a look at your environment and how it's set up. We're talking about rolling, so the floor is the best place for us. So a little bit of padding might be helpful. So some carpet, a yoga mat, some blankets if that's what you have around to make it more comfortable. And then also think about what you have close by that's going to be motivational for them to move. Today, I have some string beads that are visually appealing because they're shiny and they also make a little bit of noise, so that's motivational. And then at the head of the baby, I've got a mirror set up. Often I find that once they catch a glimpse of the mirror, that will be their visual motivation to continue to move. So today we're going to start with talking about rolling from back to front, so back to tummy. And when we first look at rolling, we want them to do, and any kind of movement really, we want them to do as much of it as they can on their own without assistance. So sometimes all we need is that visual motivation to move. So our eyes are often going to lead our movement. So what we want to see is, and with your baby, they'll probably follow the motivational toy better than my baby will. So what you want to see is that their eyes are following that movement, and that might be all the help that they need to make that roll happen. Then they kind of get their body set up into the right position to just keep going. And then if not, you can again make some noise and see if that helps them go just a little bit further. If they do need a little bit more help than that, you're going to start it the same way. So you still want them to start the movement with their eyes, get them looking this way, and then you're going to help bring that top leg over top, ground through the pelvis, and keep rolling here. You can still use the visual distractions or motivation to sort of get their attention to continue the roll with their head, their neck, their upper body, and then use hands-on as needed. So to come back the other direction, what you might notice is if you have them moving here, the arm might block them if it's down. So what we're going to do is we're going to help them bring those arms up so that they're kind of right along the ear, and then we're going to help move that lower body again. So we're helping them shift that weight, roll over with the leg, and then you'll feel their body and gravity take over and complete that movement. So what that's going to look like from the other side is that arm comes up, you help move that leg, ground the pelvis, and then they're going to come over. So that's rolling. Thanks for watching.